Thank you. Thanks very much, and on behalf of everyone who's here from USAID, I really want to thank the organizers and all the participants for the opportunity. It's been a really a great chance for us to learn and to share a little bit about the activities that we're supporting for social inclusion at USAID. So since they say that a picture is worth 1,000 words, we have a few photos that we want to show as I'm talking about the different types of activities that USAID supports for social inclusion. We've talked a lot here about the frameworks, the WHO's ideal set forth for us that all people have the right to the highest attainable standard of health. And we've talked a lot about the SDGs and the goals that the international community has come together to embrace for a more purposeful and better society. And I want to talk a little bit today about the disproportionate barriers that exist to accessing those health services. And the fact, I think it's important to mention that those barriers result in inequitable health outcomes. So as we move forward in our thinking on the frameworks and the enabling environments, I think we also have to look closely at how, and specifically what works to protect the poor and the most vulnerable and to enable them to seek services. USAID prioritizes working within the global community to ensure that the current emphasis on quality health services for all reduces the equity gaps that we see in health outcomes. So working with our partners, we collaborate with civil society and other partners to develop essential health care. The goal, I think, is to improve the health system's capacity and effectiveness so that we can see improved delivery of quality and equitable services. Important for this, of course, is data, and I want to mention that because I think we've put a lot of emphasis, particularly in recent years, on the quality, timely data that really identifies those populations with disproportionate morbidity and mortality rates so that we can design more effective programs. In addition to having the data, I think we need to have the analysis. And that analysis can help us in the program designs to really specifically address those inequities. Some examples that we've talked about are women who have HIV and limited financial means. They face often discrimination in health facilities, which discourages them to seek care. A high out-of-pocket costs. We've also talked about that prevent the poor from receiving treatment. And people who live in very remote communities, far away from health centers, can miss out on life-saving treatments. So on those, I want to talk about a couple of examples of what we've been working with partners to address those barriers and those inequities. So we tried to promote equity and social inclusion in a number of ways. We've raised awareness on the issue of disrespect and abuse of women during pregnancy and delivery and tried to identify some solutions to address this. That means addressing the needs of the patients, first and foremost, but also the professional needs of the healthcare workers to improve the quality of care all around. We've organized quality improvement teams, site counselors, the monitoring of mistreatment, mentoring, and mediation and alternative dispute resolution. So we know from a multi-component intervention study in Kenya that those interventions in the facility and at the community level did yield a decrease in abuse, and that's an important step forward. I think we also want to highlight the work that USAID has done with disabilities. And there's actually some posters outside that show the work that we've done to promote work with women and disabilities to become leaders of their own organizations. And I think the last example that I'd like to talk about, because it's so important and underpins so much of what we see as barriers, has to do with healthcare financing. And USAID, along with many other partners here, has worked in a number of key ways in healthcare financing, trying to look at the out-of-pocket expenditures that really are such a barrier. Some of that is expanding health insurance And some of it, I think, that needs to be highlighted is promoting demand-side interventions and performance-based financing, including such interventions as conditional cash transfers and voucher programs to increase the responsiveness of health services to those that need it the most, and the use of performance-based incentives. We also work in country to raise domestic resources for the healthcare sector and try to take advantage of economic growth in countries that have been experiencing that for the benefit of health and the poor and the underserved. So those are just a few examples. There are more, and I know that the other panelists will have other important highlights in other areas to contribute, and welcome the questions. Thank you.